Good morning, class. Today we explore disaster recovery and reconstruction, the long-term phase that begins once the chaos of a crisis settles. Recovery goes beyond fixing what was damaged. It aims to build stronger, more resilient systems that can withstand future hazards. Think of it this way. Response is putting out the fire. Recovery is redesigning the house so it won't burn down again. Now that we understand the purpose of recovery, let's look at the foundational public health priorities that guide the process. Emergency needs. These address life-saving essentials such as first aid, safe shelter, clean water, and food. Without a prompt response, illness and death rates rise quickly. Recovery and reconstruction. This involves rebuilding homes, schools, hospitals, roads, and restoring livelihoods so that communities regain stability. Resilience. The goal isn't just to rebuild, but to rebuild better, using safer designs like flood-resistant hospitals or earthquake-ready classrooms. Healthcare access. Continued medical services are vital. Mobile clinics and trained community health workers often provide care where health facilities are damaged. Example: after a flood, emergency teams provide first aid immediately, while long-term planners focus on constructing flood-resistant health facilities. With these broad considerations in place, let's move into the specific responsibilities of public health agencies during recovery. Assess population health. Monitoring health trends, disease outbreaks, nutritional status, mental health helps determine which interventions should come first. Community programs. Vaccinations, clean water projects, and improved sanitation reduce disease risks after disasters. Policy guidance. Public health experts advise governments and NGOs to ensure reconstruction decisions are safe, effective, and evidence-based. Example: after hurricanes, rapid vaccination campaigns often prevent waterborne disease outbreaks. Effective recovery doesn't happen by accident. It is grounded in core principles that ensure actions are strategic and sustainable. Evidence-based planning. Data from health surveys and hazard maps help allocate resources wisely. Community participation. Locals best understand their needs. Involving them leads to more relevant and accepted solutions. Sustainability. Rebuilding must consider environmental impact and future growth, not just immediate fixes. Example: following the 2011 tsunami in Japan, planners collaborated with communities to design safer, more sustainable neighborhoods. Building on these principles, let's look at the planning strategies that guide early and long-term recovery. Rapid needs assessments. Identify immediate gaps in healthcare, housing, food, and safety. Long-term strategies. Extend beyond relief to rebuild education systems, economies, and social networks. Multi-actor coordination. Collaboration among governments, NGOs, and communities avoids duplication and maximizes resources. Example: following the 2010 Haiti earthquake, NGOs partnered with local groups to rebuild essential services like schools and clinics. A major element of recovery involves temporary living arrangements. Let's examine how shelters operate and support diverse populations. Safe and accessible shelters must accommodate children, older adults, and persons with disabilities. FNSS provides medical care, psychological services, and mobility assistance to support diverse needs. Integration with healthcare. Shelters must link residents to both routine and emergency medical services. Analogy: FNSS acts like a toolkit for inclusion, ensuring everyone receives the support they need. Alongside shelter, another critical area is ensuring uninterrupted access to medication, especially for chronic conditions. Storage. Medicines must be protected from heat, moisture, and contaminants. Supply chains. Efficient transport ensures essential drugs arrive on time. Prioritization. Life-saving drugs, such as insulin or antibiotics, must be delivered first. Example, after a cyclone, mobile pharmacies travel to remote villages to deliver essential medications. As health needs are stabilized, economic recovery becomes vital to restoring independence and community resilience. Medical shelters provide immediate care while permanent facilities are rebuilt. Rebuilding the local economy, restoring markets, repairing roads, and supporting livelihoods helps communities recover faster. Community involvement. Locals should lead and participate in recovery to ensure relevant, lasting solutions. Example, following Typhoon Haiyan, fishing communities were supported with new boats linking economic stability with health recovery. Recovery isn't just physical or economic, it also involves restoring the social fabric and preparing for the future. Social recovery, reuniting families, reopening schools, and reviving community networks rebuild cohesion. Mental health programs, counseling and support groups address trauma and promote resilience. Preparedness. Recovery should strengthen awareness and readiness for future disasters. Let's look deeper at how shelters can meet diverse population needs throughout recovery. Accessibility must be inclusive for elderly persons, children, and people with disabilities. Hygiene. Clean water, sanitation, and waste management prevent disease. Security. Residents must be protected from exploitation, violence, or unsafe conditions. Key point: a shelter is not just a roof. It must uphold dignity, safety, and health. To expand further, here's a closer look at how functional needs support services operate within shelters. Medical support ensures treatment for chronic conditions continues. Assistive devices, items like wheelchairs or hearing aids, help maintain independence. Integration connects residents to broader community services like therapy and rehabilitation. Example, some shelters include dialysis units or physiotherapy stations to ensure uninterrupted care. Behind every effective shelter system is a strong network of planning, coordination, and monitoring. Collaboration. Governments, NGOs, and communities must work together. Prioritization. Vulnerable populations should receive first access to services. Monitoring. Tracking medication usage prevents shortages and misuse. Analogy. Shelters function like mini hospitals, providing integrated care in one location. Some health needs require even more specialized continuities, such as dialysis care. Vulnerable populations, dialysis patients need uninterrupted treatment. Continuity of care, essential services must remain functional during reconstruction. Communication and community involvement, updates and volunteers help ensure continuity. Key takeaways. Recovery integrates health, infrastructure, economics, and social systems. Evidence-based planning and community participation are essential. Vulnerable groups must be prioritized to avoid widening health inequities. To emphasize inclusivity, let's focus on one group particularly affected by disaster recovery: people with disabilities. Statistics. Roughly 15% of the world's population lives with a disability. Needs require accessible shelters, communication tools, assistive devices, and continued health care. Approach: partner with disability organizations to design inclusive recovery strategies. Example, in earthquake-prone regions, shelters include ramps and tactile signage to ensure accessibility. As we conclude, let's return to the big picture of disaster recovery. Recovery is a long-term, ongoing process. The goal is to build resilient, inclusive, and sustainable communities. True recovery integrates health, infrastructure, economics, and social systems. Public health leadership and active community participation are essential for lasting progress.